I'm Dr. Troy Spurl, and our podcast is Synapse SNPs. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse SNPs each and every week where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's official Synapse, SYNAPSE.com. Hello and welcome to Synapse SNPs. This is Dr. Troy, and today I am joined by two of our newest onboarding chiropractors here at Synapse. This is Dr. Katie across the table and Dr. Zack. So just want to talk today a little bit about a few processes, some of our gems, especially as it relates to fatigue and any type of brain fog, and also just get to know you guys. What you're about, and I'm going to ask really hard, complex neurologic questions. I'm just joking. So let's just start with Dr. Katie. Tell us a little bit about just who you are, some of your favorite hobbies, and then one of the things I know is you actually come from a chiropractic functional medicine kind of a background in your family, and so this is kind of in your blood. So tell us a little bit about that, and then we'll move on to Dr. Zack.
Yes. So grew up in a chiropractic family. My dad is a chiropractor. He's been practicing for about 30 years, and he does muscle testing, functional medicine. So that has always been the norm for me. I grew up as a competitive gymnast. We kind of laugh about it, but I feel like him adjusting me regularly was the only way I got through such a tough sport without any major injuries. So I firsthand felt and saw how holistic medicine and healthcare was beneficial.
One of my favorite things is actually people have had real life experiences. I always joke because one of my patients who's a gymnast, they're almost exactly the same as my rugby players. Like as far as how their body gets beat up.
Yes.
Dancers, gymnasts, and rugby players, and football, I'll throw football in there too, they tend to get their body just really beat up. So it's good to actually have that experience.
Yes.
And so a lot of the people out there who are gymnasts or have kids that are gymnasts will recognize too just how much the body does get beat up. How do you think that actually helped prepare you for? You've been through school now. You're here.
Yes.
I know you had multiple offers, and we're thankful to have you here at Synapse. But tell us a little bit about just how you think that prepared you for what you're doing here in functional medicine world now.
I guess from a young age, I became very in tune with my body. So I could tell if I ate certain things before a long practice, I would feel a certain way. I wouldn't have energy, or I'd feel great. I'd have a great meet. Sleep would play a big role into that. Managing stress. I could feel if I needed an adjustment in a certain area and how that would impact athletic performance and even school performance and how I felt overall. So I think that has helped shape where I am today and realize that you have to look at the body as a whole. Biochemically, structurally, emotionally. I mean, even the emotional component is a big component. So
yeah, we're going to touch base on that a little bit in our conversations a little bit. So this is one of the reasons why we've hired Dr. Katie. She's one of our leads here at Synapse, so she'll be helping with a lot of our functional medicine programs. And all of you know just how busy my schedule is, so these are the two that are saving me. These are my official life preservers when it comes to keeping me afloat so that we can get as much help here as possible. So let's just shift a little bit and go to Dr. Zack. Were you a gymnast?
No. I did tumbling when I was like 5 or 6. So
he fell down a lot.
That counts, yeah.
So tell us a little bit about yourself, Dr. Zack. You've been practicing for a while and have a passion for a lot of the physical stuff. As you can tell, both Dr. Katie and Dr. Zack are in good shape. They take care of themselves. I know, though, for you physically, you've got a strong drive when it comes to the physical part of health and healing. And I'm officially introducing you to all my patients who've been asking who you are. I'm like, that's Dr. Zack. he's my backup. So I think when you need the adjustments and I'm not here or my schedule's too full, you're going to go see Dr. Zack. So this is officially Dr. Zack. So tell us a little bit about who you are. We know you've got a family. You don't have to go into details about the birth or anything of your children,
Sure.
but yeah, tell us a little bit about who you are.
Yeah. So some similarities, it sounds like, with our childhood. I played pretty much every sport at one point or another growing up. And that's actually probably what initially led me to chiropractic. Got hurt a couple times, headaches growing up. And that was really one of the only things that helped, was getting adjusted with that. I do have a family, got a wife, 2 kids, so that takes up a lot of any free time that I have.
Do you like them?
Yeah, they're okay.
Good clarifying questions.
But like you mentioned, I have been in practice for, I think this is 3 years now. Done a lot of adjustments, probably like 100 to 200 a week was what I was doing, so pretty familiar with that side of things.
Yeah, he can adjust very, very well. So can Dr. Katie. So that's one of the reasons why I'm bringing you guys on here. So I know we'll talk a little bit about the interviewing process and stuff and some things made you go through. But yeah, keep going. How did do you enjoy adjusting people? I mean, that's a lot of adjustments in a week. So
there was a lot of adjustments in a week, but yeah, I do enjoy it. For the last couple of years, developed more of a passion for the sports side of things as well. So I've done some additional training and education on sports rehab. I had the opportunity to open my own small practice in a CrossFit gym I was a part of, helping some of their members with injuries that they had, getting them back to the activities that they like to do. So I spent a year and a half doing that and kind of fine-tuning skills when it comes to the rehab side of things.
So I think there's an interesting story here. I'm not sure, but tell me why you're here, because you were very busy. You were good at what you do. There's a little bit of a story about having the experience with Synapse before working here. Do you mind sharing just a little bit about why you're actually here, why you're at Synapse?
Yeah. So I was a patient here 5-6 years ago during school. I had some things that were going on during chiropractic school and went traditional medical route for some of it and didn't see any results with that. Was getting adjusted regularly at school. Some of them not very good with the interns.
Yeah, they're learning there at
younger
school.
tries, but getting things moving, and I mean the body felt okay, but still some abnormal symptoms. And I think it was my mom. She had been here before and recommended to come check it out, and that changed everything for me. Seeing how when we look at every part of the body, like you were talking about, it's not just the physical, but kind of healing from the inside out, and that changed a lot for me. And now my son's been a patient here too, and very similar things, done all the lab testing, the imaging with what traditional medicine has done, and no answers. It's just put him on these medications and see what happens. Yeah. And I mean, he's 7. I don't want him on medications like that. Yeah. So that part for me and my wife has been life-changing. Seems a bit extreme, but very close, right? Because
it's your child.
Yeah, it's hard to figure out, at least from a communication standpoint, exactly what's going on. So to finally get some answers on what's going on with him has been it's been amazing.
Yeah, we're glad to have you too, and I know you just expressed a desire to just be around the functional medicine side of things. So I can tell you both have a passion to get to the root cause, which is one of the things that we teach, but also we strive to do as best we can. So yeah, that's been great. Why did you end up here?
I would say a couple reasons. The muscle testing and functional medicine was something I was really looking for, because I want to heal someone holistically, not just look at one side of health. 2, I would say the culture here. I wanted a place where I could continue to learn and that everyone would be working together. And I could pretty quickly, early on, see that everyone here works together. It's kind of like a family. Yeah. So I would say those are my 2 big reasons.
Yeah. So I like that. I don't actually know these answers, so when I ask some of them, so I never know. But so you guys have been here for a little bit. We're just getting through the training process, and the training is mostly about our systems and learning our protocols and our people and how we communicate. Synapse, actually, this is for everyone listening too, but the reason why I called the clinic Synapse is because it's the part between two neurons in the brain, but it's the junction where communication occurs. So if you think about what a synapse is, it's where communication occurs. When I was learning how to become a good practitioner, I found out early on that all dysfunction and eventually disease comes from a breakdown in communication. So communication is key. So that's actually why I named the clinic Synapse. It's the junction where communication takes place. And 25, 27 years later, I'm still working on getting good systems to communicate between staff members, between doctor to patient. It's an ongoing process, just like the human body. So with that being said, you guys have experienced some of our team, some of our process already, not everything. As we're going through it, we're going to release you to the wild, so to speak, in about a week or two here to everyone else. But you've been already going through a couple weeks of training, and just tell me a little bit about your experience with the team and the processes and what you're learning. Is it what you expected? Give the people listening a little insight behind the scenes, because when patients come in here or people listen to the podcast, they hear things, but they don't get to experience it. So you guys got to be that voice for them right now. Let's start with you, Katie. Just what have you seen and experienced, and what do you like about, don't go with what you don't like. Don't do that.
Okay, I
don't
won't.
do that today. Okay. Just with some of the process and some of the behind the scenes stuff, because our patients hear that we meet every day to go through patient cases, but can you talk or speak to that as far as what you've seen?
Yeah. I would say for a new hire, I mean, any job is overwhelming at first.
Yeah.
I would say so far, I've only been here a couple days. It's really nice to take things slowly.
Yeah.
I can tell everyone wants me to be on the same pace as them, get to know everything about the clinic before I'm off with patients and doing my own thing. So yeah, I like how it's been a little bit every day, like an hour of training, and then we'll always have a meeting so I can kind of see all the other team members and keep in that communication. So I really like that so far.
Yes. And Zach, you've been here a little bit longer. What observations do you have as far as the processes?
Well, this is the third clinic that I've worked in, and the training has been so different than anything else I've been a part of, just with the level of organization and detail. That's...
Okay, I thought you were gonna go to like it's bad. Like it's
No. Like, I mean, everything is laid out for us for the full 3 weeks. Like topics we're going to cover, who we're going to be shadowing, what processes we're looking at, and just I know you already talked about the teams meeting together and bouncing ideas off of each other. The resources that are available to us to do our own deep dive on some of that stuff as we're trying to figure out, questions that come up throughout the day too. It's been really helpful.
Is it a little bit like drinking from a fire hose still? Because I kind of like
Absolutely.
that idea.
It is,
Okay,
yeah.
right, yeah.
I think it always is,
It's
though.
got to be a little bit like that because it's new.
Yeah.
We don't want to overwhelm. We want to support. So, that's good. That's the intent. And so we're looking at that because at Synapse, one of our core values is excellence without ego. And so we want to develop that excellence as far as training, good communication, but at the same time know that you're supported by a team. Because there are things I have to leverage my team for all the time. You guys have seen me in the room doing training videos, and I look over to Dr. Josh and say, how do I do this? Like, it's happened every day. That's true for all the different cases. Everyone else that's in the room, I'll ask the nurses. So it's super nice having that team backing you to ask about their specialty. And then when they dive into it, even things like the IV therapies that we do, one of our other nurses who's a wellness coach, you've seen her, Doctor, I just promoted her, Dr. Ellie. Ellie, just her knowledge on some of the things that she has with the mindset, the wellness, and to be able to pick her brain as we're discussing different cases and stuff. I absolutely love it when people come prepared with gems and they have knowledge that I don't have or I forgot about. So we know we've got two good ones with you guys adding to the team and the value there. So yeah, good to hear, and we will stay the course with that. So we're glad to have you. Let's move into one of the main topics here. I want to talk about something that we've touched base on. It's a very common condition here, so I want to run through that a little bit. It's upper airway resistance syndrome. We've talked about it on podcasts before, but we're going to do a deep dive just into some of the things that you actually see. And so you guys have been in one or two of the trainings where we've discussed it. You've been shadowing a little bit. We've seen it. So I'm going to talk to you a little bit about that. But I want to go through this. And many of you have heard me talk about this on the radio and podcast. But upper airway resistance syndrome is a hidden sleep disorder that many people have. They don't know they have it. The reason why it's so common is simply because of stress in the back of the neck. It's as simple as that. So people who have too much tension in the back of the neck can develop upper airway resistance syndrome. So I'm going to walk through that a little bit. Let's go. I'm going to use Zack on this one. So normally I use my muscle as an example. I want you to lift up your muscle. Yeah. He's not even flexing. now I need to no, don't flex. Lift up the muscle, and you can see the bicep. When that bicep contracts, the brain is sending a signal to contract that muscle, but it also sends a signal underneath. You can't tell, but his tricep is being relaxed. It still looks like it's flexing that too. But that is called reciprocal inhibition. But we have basically a contraction of one muscle and a relaxation of the muscle on the exact opposite side to allow that function. When we have too much tension in the back of the neck, then it can cause a relaxation on the front of the neck. Now, the strange phenomenon is it also, over time, gets signals to start working, so it starts to get tighter over time. So we end up seeing people with a chronic condition have tight neck muscles in the back and then a weakness in their muscles that help control and open up their airway. Long story short, when they go to sleep at night, there's a component where everything gets shut down. Your brain shuts down your entire body, everything goes paralyzed, but your airway is meant to stay open because I've heard, correct me if I'm wrong, but the brain likes oxygen. You guys concur?
I think so.
Yeah, so they're on board. So that's one of the questions we ask in the onboarding interview process. So with that, a lack of oxygen, brain says danger, and it sends a signal to your adrenal glands to release adrenaline or cortisol, a stress response, and it pulls you out of that deep sleep. So then it becomes very important. There's all kinds of consequences to that, where you end up in what we call fight or flight versus rest and digest. So it becomes very important to assess what is causing neck tension. So off the top of your head, both of you guys, just name one thing that you know of that you've seen with yourself or patients that causes neck tension.
Stress. Number one. I think everyone always carries the stress in the upper back and then the neck.
Traps, when we stress traps and neck, by far number one. And don't say she took mine.
I was going to go more posture or muscle imbalance.
Yeah, muscle imbalance. The number one muscle imbalance that can set that off, core weakness. So when we see a weakened core, it can lead to the upper back having to fire more to actually maintain that function. We also see different rotation, like people as they age tend to flex forward. So what are some of the other things you've seen with the work you've done with your postural restoration and things of that nature in the past? Does shoulders play into it? Do pecs play into it? Tell me a little bit about anything else you've seen that way.
Yeah, I think both of those I've seen even in like lower traps. Do the opposing action of the upper trap with the scapula in some sense. So a lot of people have weakness in the lower trap, and upper trap gets overactive, and actually strengthening lower trap can downregulate the upper trap.
Yep.
Stuff like that.
Yeah, we kind of saw a similar process this morning when we're just kind of talking here. It's a cloacal reflex scenario, but we see how the muscles on one side of the body can affect the muscles on the other side of the body. So the muscles, we'll do a podcast on this one of these days, but the body is very complex. So you have a lot of muscles and communication where they are all communicating on the same side, but also on opposite sides. So postural stuff is also very important. But you kind of nailed something there with the lower core, or the core being a part of it too. Intestinal inflammation is another thing that can cause neck stiffness. Intestinal inflammation also happens to weaken our core muscles. Pregnancy and delivery of having an actual baby can weaken core muscles for apparently both the men and the women. I can't tell you how many men go through pregnancy and gain 20-30 pounds with their wife as they're going through the actual birthing process. So, but we see that core weakness actually develop into potential problems with the neck tension. Intestinal inflammation is one of the biggest ones that we see also cause that. So there's a lot of things with diet and lifestyle that can create that problem with a stress in the back of the neck, and then you see a sleep disorder developed, then we're in for it, right? So as they have this upper airway resistance syndrome sleep disorder, you're not getting fully restorative sleep each and every night. You can wake up the next day and feel completely exhausted still, or like you haven't slept. So here's how you know if there's a bit of a challenge there. If you wake up and you don't feel rested, if you don't remember your dreams, or at least that you do dream. You don't have to remember them every night, but we should remember dreams, or at least that we are dreaming. Number 3, if you can take a nap at any point during the day for more days out of a week than not, then that's a sign there's a sleep disorder as well. Now, caveat, if you have young kids at home, game changer. If you have kids waking up, everything that goes out the window except for the stress in the back of the neck stuff is still accurate. So just know that sets off a pattern where you end up not getting into deep restorative sleep. Every night, that's when our body's immune system cleans things up. So you don't push out the lymph in the body or the head. If you don't push out the lymph in the head, that can manifest as headaches. That can manifest as foggy brain. So that's one of the causes for headaches and foggy brain is the sleep disorder. Now, what I like about it is that to actually correct the sleep disorder, you have to fix usually their digestive system, and chiropractically you have to fix the structure of their airway and their head. And that's essentially what the two of you are here to do, is to correct structurally and through diet and lifestyle and therapeutic supplementation sometimes, their digestive system response. You mentioned emotional triggers as well. We have coaches that work with that as well, that help with the emotional part of it, but we also do something called the clearings here. And so that can help identify and reset emotions that can trigger stress too. And some of you have seen that patients already ask for that. Like it's just an expected thing to reset this because they want to reset the physical consequences of their stress response. So it's been very life-giving for a lot of our patients to add that component. So when it comes to this particular sleep disorder, upper airway resistance syndrome, or this pattern, just give me an estimate. Have you seen this yet with any of the patients I've been assessing? Have I talked about it in the first little bit? What would you say?
Yeah, I would say 75%
Yeah.
something like that. And I suspect family members that I know go home and test them and see if they have that too. So yeah, a lot of people.
Yeah, it's pretty common. Have you seen it?
Yeah, I think even just observing you the last couple of days, I've already seen it in a bunch. So it's a common pattern.
Very common. And we actually found that with a medical doctor. You guys have seen some of our podcasts with Dr. Strand years ago with our fibromyalgia patients. So a lot of men and women with fibromyalgia, well actually not a lot, 100%. So for 100% of all of our fibromyalgia patients have had this sleep disorder. And we found it, he actually put a camera down their airway or hooked up to their airway so we could actually see the airway collapsing at nighttime. And then we had a camera on the outside where we could actually see their body position. And a lot of these, it's mostly women actually, 80% of the fibromyalgia patients are women, but they would be sleeping and then they would find themselves on camera like this. And for those listening on the podcast, what I'm doing is not seeing it on camera. I'm actually taking my hands, torquing my jaw off to the side and pushing on my head with my other hand. They're basically opening up their airway because it's collapsing so that they can get into deep sleep. Some people will use a CPAP still to force the air in, but that doesn't allow for the strength of the lungs and everything to be maintained. So we want to actually strengthen the muscles and rejuvenate that entire area. So that's originally how we found it. So we started checking it on all of our patients, and turns out the majority of our autoimmune and the majority of our fibromyalgia, like we said, are chronic fatigue patients. So it was very, very common, especially our initial exam. So that's one of our foundational things here, is to make sure people have that sleep restoration, because once you restore your sleep, that is a game changer for your immune system, for your recovery system, for your energy system, for your digestive system. And think about how many problems people have, and that is a big part of all of them. So mostly, if I had two things where I had to just correct and fix, it would be digestive system and sleep system, those two things. and if I could only pick two, so how you fix it is why you're here. So is there anything that has surprised you guys with what you've seen with some of the patients and observations? Because we don't throw you right into the lion den right away. We have you observe a lot of patients and some other stuff. Is there anything that's been surprising with what you've seen, or good or bad? And just talk to that a little bit. How about yourself, Katie? You want to start?
I would say I've seen a couple patients come in and seem very in tune with their body. Like they will almost tell you what to do,
Yes.
which I love because it's easy to work with a patient that wants to get better and has done some research and knowledge of their own and kind of know what's going on with their body. So, and I can kind of resonate with that because that's how I used to be too.
Yeah.
I'd tell my dad like, hey, I can tell I need this adjusted. So,
Yeah, and so one thing I'm going to speak to on that is it's important for us to listen to those people, and it's important for us to discern, because I know we've had this conversation. This person is telling me what's wrong with their body, but are they in tune with their body? Some of y'all out there think you're in tune with your body, and you're just not. But a lot of you are. So the one, I think I know who you're talking about with the one person, and sometimes you can take it to the bank. So it's important for doctors to be flexible enough to listen to the patient. I cannot tell you how many times I've heard patients come in and say, I don't feel heard. Traditional medicine or non-traditional, because the treating practitioner or the physician is trying to fit them into the protocol that they've established. At Synapse, just so everyone knows, our goal is to have a good assessment of the body and see what the body is communicating to us. Sometimes people aren't as aware, and there are reasons for that too. We've had people who've had strokes, people who have hormone imbalances, the sensory problems. You can't be in tune with your body. We actually have ways of assessing that. I showed them a little earlier, one of our tools. We actually assess kind of your personality types and have a way of identifying if you are in tune with your body or not. And it helps us because people who are in tune, you can take to the bank that they're giving you some good guidance. People who aren't necessarily in tune, we have to do our due diligence and test things out in a little bit different way. But that becomes a finding in its own right as far as seeing if that's improving. And our goal here with our programs is to educate people about their body. So we ultimately hope to get people to the place of being more in tune. You were very fortunate to grow up in a family that did that.
I was.
Automatically.
Yeah.
That's actually, people spend a lot of money here to learn how to do what she was just given in her life because of how she was raised. So that is a blessing to have.
It is, yes.
How about yourself? Any surprises, any gems that you've seen, or just anything to comment on?
I think the first thing that comes to mind is the variety of conditions that we're able to help. I know I had made a comment to you after seeing one of your patients that had a rare disease, and I just asked, coming out of chiropractic school, did you ever imagine that you'd be able to help patients with this? And I know I didn't. I mean, we were taught to treat neck and back pain, essentially, and there's just so much more that we can do for patients.
Yeah, that was one of my foundational things, is that I believe there's an answer to every problem. I don't believe we have the answer to every problem, but I believe there's an answer to every problem. And so taking on some of those challenging cases very early on, when I would get stuck, it would drive me to learn more. And so here at Synapse, we tend to attract lifelong learners. We just do. Because during the hiring and interviewing process, I kind of lay it out. This is who we are. This is what we're about. And some people get up out of the interviews and walk out. Like, I share my faith. Do you remember?
Yeah. Oh, yeah.
So I shared my faith. And it's not that you have to share the same faith, but you need to know that I'm going to talk about God and Jesus. And if that offends you, maybe not the best work environment for you. And I just want you to know that ahead of time. If you want to come to work and argue with me all the time, I would love to talk to you and stuff like that. But just laying it out there. And so expectations of, I want you to start wherever you are and get better. I want you to learn. I want you to be a servant leader for our patients. Certain people look at that and gulp and say, holy smokes, that's not what I want. I just want a job, a paycheck, and go home. And I'm out. And other people, like yourselves, are like, I'm in. And I gave you guys multiple opportunities to say no and say I'm gone, and they still chose to come in. So it's an early onset vetting for lifelong learners. There's intent behind it, and the reason is because we have a very driven mission. We are going to change healthcare as we know it. We are going to be working with complex diseases, not just from a functional medicine perspective, but teaming up with good traditional medicine as that morphs and just completely changing healthcare. So I'm very excited because we're in obviously the early stages of seeing that come into fruition. And a lot of you guys that have been on the podcast know the interviews we've had with the different medical doctors and surgeons who are talking about the collapse of our current system and the changes they hope to see. Those are meetings are happening weekly and monthly all the time. And so our PA just this morning was at a talk in Regions downtown, speaking there with Dr. Tom Blee, that many of you know, the trauma surgeon. And so the impact is being felt not just with our patient population, and the outcome, I'm just going to say this, the outcome of the traditional medical system working with a functional medicine system, where the functional medicine system gets put in the lead as a first line therapy first, that's going to be a game changer for people and their health. The outcomes are going to be better health for people. And we still need a lot of our traditional system, and we need functional medicine to become the leader in proactive healthcare to keep people healthy. So yeah, a little bit of the vision there for everyone as well. And the complex scenarios, yeah, you guys keep giving. You guys are all givers as far as some of the complexities and stuff. So this week we've had people traveling from out of state, and we've seen everything from cancers to tic disorders to movement disorders. Even someone almost passing out in our lobby waiting to get in. So we get a lot of different things. And so luckily we've got nurses here and medical doctors, chiropractors, trauma nurses who are ER trauma and emotional trauma. So it's just brilliant, the people that are coming in. And so we wanted to welcome our two new additions just to add to that excellence. And you guys that are listening are going to love the expertise that they bring. And I want to thank you guys for joining me today. Is this your first podcast?
Yes.
It is, yeah?
It is,
Check
yes.
that box. Good job,
I
guys.
know.
All right, well, thank you all, and thanks for a lot of the messages and questions you've been sending in. I want to just remind for the people that can't ever get to Synapse, we do have the monthly talk with the docs. So you can call the clinic or go to our website. Clinic number is 651-209-9906. Ask to enroll with the talk with the docs. It's $20 a month, or there's a discount for paying a 1-year membership. And you get to log in, ask me any question, health related, but you're in a group format, so don't be asking about your herpes outbreak or anything like that in the group format. But you can ask general questions about yourself or other family members. I will point you in the right direction as far as resources, health as best you can. It's a very cost-effective way to get potential solutions and answers. If we have protocols that we can just send you, we will do that. So we've done that quite frequently for people. Our patients love it, and you can get a lot of your questions answered, especially for the ones that can't get to Synapse or become a patient for us directly. Go ahead and sign up for the Talk with the Doc, monthly Talk with Dr. Troy. Website is official Synapse, synapse.com. Thanks again, and until next time, this is Dr. Troy, Dr. Katie, and Dr. Zack. Bye-bye.
Thank you for listening to the Synapse SNPs podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse SNPs podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or a substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.